Chiamerei sul tavolo il dottor Jens Tuelsner, che ringrazio infinitamente a nome di tutta l'associazione per la sua presenza, che per noi è particolarmente significativa ed importante, e apprezziamo molto non solo il fatto che viene da molto lontano, non dico proprio dalla fine del mondo, come ha detto una figura della quale io sicuramente non sono degno di profferire neanche lontanamente, però ci parlerà ampiamente dei servizi sanitari a bordo di AIDA. Prego.
I think most of you will understand that it's a very exciting honor for me to be here. When I was a young man, I have a teacher for singing. And he said to me, Jens, never enter a stage with asking for an excuse. I have to break the rules now. First of all, I have to excuse not to speak in Italian, as fluent that I will be able to present this in Italian already. Giacomo does his best already to push my Italian up, and at least it is on a level I can understand the most, has already said in this auditorium. And the second excuse will come a little later. It's already a couple of months that Paolo Cremonesi asked me for giving a presentation about medical service on board AIDA vessels in this Congress, and was really proud to be asked about. Nevertheless, and now that's the second excuse, Professor Cremonesi, I'm sorry. I think we face a lot of changes, and there were some of the speakers today already mentioned it in, let's say, different ways. So I thought it might be much more smart to talk a little about the upcoming changes and the positions of us, much more than to speak about things that are established already. And as we will have a common future together, we will face these things together. So I changed it. I changed it to medical service on board and safety. And it's a second honor I'm a little proud about, that I can tell about myself now. I'm a part of a very traditional company of Italy, of the Costa company. That's very proud I'm very proud of. So we all are doctors. Sorry, Daniela, some nurses as well. And sorry if I'm wrong at this particular place. At least in Germany, every doctor is very proud and very safe about himself. I'm, let's say, a synonym of safety and security for my patients. I think all of us face or have this in mind and think about our profession and about our daily service we provide to our passengers or crew, or let's say it at least to our patients. So let's start me with another short story. Very actual. We had this experience only a couple of weeks ago. As you see, a 75, I have to think about, 74, I'm sorry, years old man come to the infirmary of one cruise vessel with some symptoms of cold. He comes in the early afternoon, and you see here the documentation that was provided, and he was given some anti-cold medicine and sent back to enjoy his holidays. And he was offered the possibility to have a second consultation for the doctor if the symptoms get worse or he won't feel better. He didn't that opportunity, but the next consultation happens on Sunday, nearly a week later in the morning. And you see at this point the patient presents with dyspnea, strong cough expectorations, some temperature below 36 degrees, lower level of peripheral oxygen saturation, and a heart rate about 80. So he was provided continuously the anti-cold medication, some salbutamol, some antibiotics, and he was given an oxygen concentrator to the cabin. And it was arranged to have a next consultation in the late afternoon to see how the symptoms develop further. he didn't even took this second opportunity for the next consultation. And the next situation that medical team was faced to this patient came the late evening, when the wife of the patient called and said that the situation get much more worse. The medical team went to the cabin and found the patient as described, and here you can read it. You can read it, but all of you are quite aware that gets dramatic. They brought them to the hospital, and by admission in the ICU room, they see at first this atrial fibrillation with a heart rate as described between 70 and 120. So they keep him in the ICU room and give some Briconyl and Zolidipine regarding the spastic voices on the lung. They gave some furosemide and diuretics regarding the moisty voice in the lower lobes. They gave some effusion, increased the oxygen level, and take some laboratory testing as a CRP. It's more than 80 milligram per liter, what it means not measurable. The level is much higher, and the troponin is negative. So they decided, and I think that's right, to make a medical disembarkation for that patient. The ambulance came. You know, all of you are aware how the circumstances and the environment on the world are sometimes. So the personnel of the ambulance took off the oxygen and asked this man to walk himself into the car that will bring him to the hospital then. And the next information we've got is that by next morning the patient died. I'm quite sure that it's the same for all of you. I have a lot of questions in my mind. First, the differential diagnosis. Cardiac failure seems not very probable regarding the symptoms the patient presented and the findings we've got. In the case history, is the atrial fibrillation already known, or is it new regarding the acute situation? What about having an X-ray of the thorax, of the pulmon, of the lung? Sorry. And laboratory findings: no blood cell count, no blood gas analysis, and by the peripheral oxygen saturation, we all know that there's a respiratory insufficiency. What about the acidosis? And lately, the therapy. What about the antibiotics given IV? Infusion. Then all of us are, or at least should be aware, there are sepsis guidelines. And the publication of the early goal-directed therapy in severe sepsis is very old right now. There are several reviews gone through the literature meanwhile. So I hope you understand and excuse that I take the arch to safety and medical service. I don't want to come up with the safety issues other departments in the cruise industry may have. Let's face ourselves, look in the mirror and look what we can improve in the quality of medical service all of us can provide to our patients. But however, the upcoming change has had one very headline, and this is safety utmost priority. And this means by the foundation of the Carnival Maritime Company as a daughter company from the Costa Group, with Costa, AIDA, and Costa Asia together. And let me explain again, together. In my perception, sometimes there's some underlying meaning that it's not really together. At least I hope Giacomo will say that we have done a lot together and moved a lot together. And lately, the next slides you will see, even in this we already agreed to do so. A short slide about the organizational chart. The FOC you already spoke about, when I understood it right. Yeah. The medical, we're part of the DPA and governance branch, and we will have from the starting May, we will have an international team even for the medical service for the Rui Costa group that contains of Italian, Romanian, and German people up right now. These are some headlines for the Carnival Maritime. The operation of the ships, so as you saw in the organizational charts, there are several departments together, means from technical, environmental, security, medical, the Fleet Operations Center, communication, technique, and so on. And the target will be that we have a stepwise harmonization and merge of the understanding and even of the proceeding and performing of medical service with focus. That's a focus for us. When we think about safety in medical service, I think there might be 5 determinants. The one, very easy, have the right people in the right place on the right time. Provide education and training to them. It's not only the responsibility of the individual, it's even the responsibility of the company to provide possibilities and chances and challenges to develop and to be educated and trained. Have the right equipment, which means not only the technical equipment, which means also the right pharmaceuticals. And I'm very happy, sorry to say that obviously the Tabella C is in a very strong reviewing, remodeling, however, so that it makes sometimes a little more easy for us. At least, as all of you know, in the cruise industry, the stuff of pharmaceuticals we have at Watt is much higher than the requirements by Tabella G. Standards and processes. I'm very aware that much of you, and sometimes let me be honest, even we are a little bored by the huge amount of upcoming processes. So be sure we will try to keep them on a minimum, but as we are members of a very great corporation, means the Carnival Corporation, we are not the only ones deciding about the stuff and even the content of the processes and standards, but be sure we will take all the power of our influence to keep the best for us. And last not least, there's governance, which is, let's say, a bilateral cutting knife. It means control, but it means also support. And when we speak about support, this means that touches the content of the next slides. First of all, we will face within, I think, the next year, the implementation of an electronic health record. I think you are aware, as I am, that is a huge project, and because it depends to some cultural changes in documentation and management. And so we try to arrange this electronic health record in a manner that is really suitable and helpful, at least for you, because you are the people on board the vessels doing the real practical work, and we are intended to provide help and make the things easier, not getting more difficult and complicated. But all of you should be aware the first step to go in this direction will be a very terrible and difficult for all of you. But we will offer training, we will offer support, and I think, to be honest, every one of you, we will see there are big challenges and big possibilities in having electronic health records, at least if you see at the potpourri of content of this electronic health record. And when I speak about support, this touches the shore side support as well. All of us have our specialties, and when I go to the beginning of my speech, all of us have our lacks in knowledge of diseases, of current treatment, of guidelines. Let's be honest, it is that way. We have our strengths and we have our blind spots. So what we try to arrange, and I'm very happy hopefully we can merge it very easily and very quickly. You in the Costa fleet already have this genial pediatric telemedical program. for every question connecting to this area of questions. And we with AIDA have a teleradiology program that the X-rays are taken on board, are sent directly to specialist shoreside, and we get the findings as well as a recommendation for further treatment. We have some cardiological telemedical program, and we have, together with the European Skin Cancer Foundation, a teledermatology program, which, no, not really surprisingly, but is very welcomed by the people on board the vessels. And we are already in contact with responsible people in all these areas to ask if we will be able, or at least if they will be able, to enlarge the program to provide us to the whole fleet of the Costa Group. I spoke about training and education, and don't worry, I won't read this all, but the message should be, we should all be very aware about the red flags. That means every condition, medically or at least medically related, can elevate to a real severe problem. So we will continue, we will develop, we will enlarge the training programs to ensure proper reaction of all of us. And last but not least, when I spoke about processes and standards, we are intended to provide some, let's say it, clinical pathways, short forms regarded and orientated on the current guidelines of medicine and the golden standards that makes it easy, very easy to deal in case you face a blind spot yourself. No problem. Just know where it is and how to help and where to get help. It's much more a question of space to present that I took the short narcosis instead of, for instance, the sepsis to close the circle. So, that's not I'm at the end, but the presentation is at the end. And I'm very open to every question. I know it's a very momento particolare, as you said. If you have questions, I'm very aware of all the rumors, the underlying concerns, and so on. And the moment I can help and solve some or answer some of them, I will do so, be sure. Thank you very much for your attention.